Welcome back to the channel everyone. This video is all about the anatomy of teeth, the complete anatomy of teeth I must say. So we all know that the teeth plays a very important role for maintaining our beautiness or attraction. The beautiness or attraction plays an important role in our personality too. But including the beautiness, the teeth also plays an important role in grinding or cutting of food particles into smaller pieces before digestion process. Here, this video of the objectives is mainly of the following topics. They are number 1, the dental formula of small child and adults. Number 2, microscopic structures seen in the adult tooth. Number 3, development of the tooth. Number 4, blood supply, nerve supply and lymphatic drainage of the tooth. And last but not the least, the applied aspects or the clinical anatomy of the tooth.
Hello, namaste, hola, privyet viewers. Welcome to my channel Med Gossip SD. I am Subhas. The main objective of this channel is we bring basic medical and clinical science topics, explanation with the related diagrams much as possible, and frequently asked exam oriented questions of that related topic. So make sure you hit that red button of subscription and the bell icon so that you could never miss the updates.
So let's start the today's topic with dental formula. We can see in the diagram there is a given of upper jaw and lower jaw, which consist of four types of teeth: incisor, canine, premolar and molar. The dental formula is mainly important to represent the number of different types of teeth according to the varying person to person. So in human, teeth is only replaced once in a lifetime, so it is known as diphyodont. Now let's talk about the dental formula of milk teeth or deciduous teeth. The dental formula of milk teeth or deciduous teeth is 2102 upon 2102. The other is the dental formula of adult or permanent teeth. The adult or permanent teeth's dental formula is 2123 upon 2123. You can see in the diagram also, and I have mentioned here also. You can see clearly 2123 upon 2123 times 2, because there is a upper part and lower part also. So talking about the next topic, the dental formula also represent number of teeth in each half of the each jaw in order. They are incisor, canine, premolar and molar. So the milk teeth. The milk teeth we have 2102, which tells that there is number of 2 incisor, 1 canine, 0 premolar and 2 molar. Likewise, the number of total adult teeth is 2123, which said that it has 2 incisor, 1 canine, premolar and 3 molar. The total number of adult teeth is 32, whereas the total number of milk teeth is 20. So milk teeth is 2102 and adult teeth is 2123. Now the next topic is microscopical structure seen in the adult tooth. Microscopically, each tooth has three parts. They are divided as number 1 crown, number 2 neck, which is surrounded by gum, and number 3 root. We can see in the arrow part crown, neck and root. Now let's talk this in structural part. The structurally it is presented as pulp, dentine, enamel, cement and periodontal membrane. Number 1, we have pulp. The pulp contains vessel, nerve and lymphatics. The pulp enters through apical foramen. Number 3, or next topic, it is covered by a layer of tall columnar cells called odontoblast. Number 2, we have dentine. The dentine is a calcified material which became impregnated with calcium salts. They are not connected with any blood supply or nerve supply. Now, enamel. The enamel has the hardest substance in the body. Enamel is also the hardest substance of the body, we know that. It lacks blood supply and nerve supply like the dentine. So next we have cement or cementum. The cement resembles bone in structures. They also don't have nerve supply or blood supply like enamel and dentin. Next we have periodontal membrane. The periodontal membrane acts as periosteum. Now let's talk about the development of tooth. The development of tooth consists of the enamel, dentine and the cementum. The enamel is derived from ectoderm, whereas dentine from mesoderm and cementum from periodontal membrane. Now, lymphatic drainage of tooth. The lymphatic drainage of tooth is lymphatic vessels from teeth and gingiva pass mainly into submandibular. Now, blood supply. The blood supply of the tooth is supplied by superior and inferior alveolar arteries, branches of maxillary arteries. They supply maxillary and mandibular teeth respectively. Now, nerve supply. The nerve supply consists of pulp and periodontal membrane have the same nerve which is different from that of the overlying gut. The upper teeth is supplied by number 1 posterior superior alveolar nerves, middle superior alveolar nerves and anterior superior alveolar nerves, which is also known as maxillary nerve, and the lower teeth are supplied by inferior alveolar nerve or mandibular nerve. Now let's talk about applied aspects. The applied aspects, number 1 we have scurvy. So the scurvy is gums present swollen and spongy. In scurvy condition, it bleeds from gum. This is caused by vitamin C deficiency. Number 2 we have pyorrhea alveolaris. It is chronic post discharge at margins of gum. Number 3 we have dental caries. It is the decal calcification of dentine and enamel. Number 4 we have apical abscess. In apical abscess is known as the infection of apex of root creating abscess. Number 5 we have Hutchinson's teeth. It is a condition of notched teeth. It occurs in congenital syphilis. Number 6 we have natal teeth. It is erupted by the time of birth. Number 7 we have tetracyclines which cause discolored tooth, and number last rickets. We can see deficiency in enamel in rickets. Now let's see applied aspects gallery. Number 1 we have scurvy. Number 2 dental caries. Next gallery we have number 3 pyorrhea or also known as pyorrhea alveolaris. Number 4 natal teeth. The next gallery we have the picture of an abscess which is also known as apical abscess. Now let's talk about the questions which may be asked in the exam related this topic. The questions are: number 1, describe the normal anatomy of tooth with its applied aspects. Number 2, what are the histology of tooth? Number 3, mention the blood supply, nerve supply and lymphatic drainage of teeth.
Thank you for making me a part of your day. I'll see you in the next video. Like the video if you did. Subscribe to my channel if you aren't already. Stay tuned for the next video in Med Gossip. Bye bye.